John, when it comes to something that you've obviously been on talking about repeatedly recently is excess deaths. How do you interpret the media and the government and the scientific silence around excess deaths? I mean, I've heard you quoting figures of 2,500 excess deaths a week, and at the height of the pandemic, the daily death toll was read out, like a tolling bell, and now no one in the mainstream and no government figures are standing up and saying, "Hold on, what's going on with all the excess deaths?" How do you read that?
Yeah, there's no question. Last week, for the Christmas week, there was 20.01 more deaths than we would expect for the same week in England and Wales. The equivalent figure in Australia is about 16%. Most European countries have had more deaths than we would expect. In America, it's harder to judge, but it looks like they've got this problem as well. So more people are dying than we would expect. So the official government line and the BBC line on this, other mass media line, is to say, well, look, this is due to disruption in healthcare. This is due to people not being able to access healthcare. This is due to organisational problems. And there's no question in my mind that there is some truth in that. But there's other factors as well. So one factor I'd like answered is we need complete data on the excess deaths broken down by people who've been vaccinated and not vaccinated for COVID with the mRNA and the adenovirus vector vaccines, and the degree to which 1, 2, 3 further doses of vaccine are associated with excess deaths. And that data is very, very difficult to get. One of the reasons I'd really like this data, Neil, is there was a study of people that died, often young people that died in Germany. It's, I guess, what we call spontaneous deaths. And in Germany, they did a post-mortem series on these. And they actually looked at the heart muscle, the myocardium, and they found focal areas of damage in the myocardium. And they're actually able to look at these areas of damage in detail. And they found residues of spike protein in there, but not the other proteins from the virus, not the envelope protein or the nucleocapsid protein, indicating that it was probably the vaccines that had caused this myocardial injury. Now, the authors of the paper weren't definitive about it. We need a bigger series of this to being done. But as far as I know, that this work is not being replicated. So when something in science like this comes up, the whole point of publishing this is not to say that's a slam dunk, we now know. The whole point is that people around the world can say, really? That's interesting. I better see if I can reproduce these findings. And given that young people are dying from spontaneous cardiac deaths, in my mind, this always should have been an emergency. We should be investigating this. The pathologists should be investigating this. There should be investigations. Then at the end of these investigations, we can say, you know what, those provisional findings in Germany, we haven't substantiated that with our research. Well, do you know what? Those original findings in Germany, well, they do seem to be bearing water. Evidence is accumulating. Therefore, we will take action to prevent further cases arising. But, it doesn't seem to have stimulated the required interest in the scientific communities as supported by governments.
The worst of it for me is that we know that people are dying across all age groups, and that it looks like heart attacks and things to do with the cardiovascular system.
Yeah.
Let's say seem to be key in this story, and the government and the media have joined hands to say, well, it's probably because people weren't able to access health services for a couple of years, and there's an end of it, rather than say, however, we really, because of the nature of this emergency, because we've got thousands of people dying a week that shouldn't be dying and haven't died like this before, we really ought to cover all the bases. But they're not. It's like, okay, people couldn't get to their GP for 2 years. That'll be it. And now move on. Again, that strikes me as sinister. Why can't they just open up and engage in a conversation that looks at all the options?
Yeah, I mean, it's somewhere between simplistic and sinister, isn't it? To say that, well, we know the cause already before we've done the investigations is simplistic nonsense. Of course, you don't know the reason for these things until you actually do the investigations. The mere fact that we've had a difficulty in getting healthcare in some parts of the society for a period of time, and now we're seeing excess deaths, that's what you would call a temporal correlation. We need to decide the degree to which that is causal, and part of it probably is causal. But I also believe that there's several other factors. And the fact that we have now, if you take here in Australia, for example, we've both instigated mRNA vaccination programs. Could this be a factor in the excess deaths? Well, I don't pretend to know that. That's why we should have the investigation. The fact that there's a reasonable risk of this, as indicated by the German data, means that the government should be investigating this. It should be giving research funding, because we have plenty of people can study this. It should be investigated as a possible cause, and then we'll know for sure. But we just don't have that. We don't have that trust in government that they can do this. We don't. Basically, I don't trust the government to take that on at the moment, because there seems to be so much interest, vested interest in not saying that they've been wrong over the past couple of years. And some people think they're a bit concerned about upsetting various components of the corporate world as well.
I'm some of those people, John. I'm some of those people who think that. When
The
it comes to
question
big
just
pharma,
the whole point about the science. I mean, there is a scientific process. You know, someone says, "Is this the case?" Then you get them, you collect more data, you reanalyze that data, and then you come to firm conclusions. At the moment, my conclusion at the moment, based on the data I have, is that the vaccines are accounting for some of the excess deaths that we're seeing. The mere fact that this is a possibility means that it should be investigated. And as you say, Neil, last week the excess deaths were 1,500 in the UK, give or take. Week before that, it was about 2,500 excess deaths in the week leading up to the 23rd of December. Just imagine there was a terrorist attack and 2,000 people were killed. Well, we don't need to imagine. We've had that, haven't we? We've had that in the 9/11 situation. And look at the response. But the fact that people are dying in diffuse parts of the country and it's not all in one place means that somehow it's being ignored, but we have this huge excess deaths. And we're not seeing the chief scientific officer, the prime minister and the chief medical officer standing on TV like we saw in the pandemic saying, well, we've got a bit of a crisis here, but we are addressing it and we are working out what is going on. It is the silence that is deafening.